I got into this field mostly because I was sick and I couldn't find a doctor to help me. And I was just really frustrated with the whole system. When your house is affected and your house makes you sick and you can't live at your house anymore, it's so overwhelming that a lot of people just go into denial. Mold toxicity has been around for years. There's like documentation in medieval times. They called it St. Anthony's fire, and people would get neurological symptoms and they would call it St. Anthony's fire because they would get burning pain and the people would literally become mentally ill.
Thank you for coming.
Oh, it's an honor to be asked to be on your podcast. Thank you, Dianco.
What I'd like you to do is just tell me a little bit about exactly what it is you do, how you practice, and how you got into this.
So my husband and I, we have a holistic health center in Miami Beach, and we offer a variety of treatments, but mostly because I was sick and I couldn't find a doctor to help me. So I kept going back to school to learn more stuff. I went to medical school at the University of Miami and I graduated in 2004. And then I was studying internal medicine in New York City at a hospital called St. Vincent's that has gone bankrupt years ago. But I was seeing a lot of end-stage illness and patients that I wouldn't take myself. And I was just really frustrated with the whole system. So I quit and I went back to school for acupuncture because I was suffering with autoimmune disease at the time. And I started going to an acupuncturist and it helped me more than a lot of the things I'd learned in medical school. So I quit my residency, went back to school, and I graduated with a master's in Chinese herbal medicine and acupuncture. And then for years, I just practiced Chinese herbal acupuncture. And I maintained my health with acupuncture and Chinese herbs and like the dietary and lifestyle stuff they taught me in acupuncture school. And I wanted nothing to do at all with being a doctor. So I did that for several years. And then all of a sudden, I was getting sicker and sicker and sicker. And it turns out that we bought a pretty little house in Miami Beach that was built in 1925. And the internal structure had mold toxicity. And a big part of why I was getting sick was mold toxicity. So I was looking for answers for why I was getting worse. And I went back to school for functional medicine and got a certification in functional medicine. And then I started studying with Dr. Neil Nathan. I studied mold toxicity. And then I studied about Lyme toxicity with Dr. Richard Horowitz. So I honor them both as my teachers and mentors. And they were like super generous sharing knowledge with me. But I was really sick. I had stage 4 cancer and I was going through medical treatment and staying at home, and our house had toxic mold. And so I was breathing in the spores and I got colonized with aspergillus in my lungs and whole GI tract. And what happens with mold toxicity is you get immune suppression. And I was also going through cancer treatment, so I had immune suppression. And then old chronic infections that I had got activated and had a party. So I was struggling with chronic Lyme that got reactivated, a lot of chronic viral infections that got reactivated, trying to get through cancer treatment, and then all of this stuff. And, you know, my husband, he had some symptoms, but he was working out of the house. I had an acupuncture practice out of my home. And then because I was sick, I wasn't leaving the house much. And it's funny because this happens a lot with mold toxicity is people feel bad. So they stop going out and doing things and they stay in their house. And part of what's making them sick is their home. And it's this deep spiral downward. Right. So I was really looking for answers. And now I'm back to work full-time, health office, and I help people for whom conventional medicine has failed.
Exactly. But I want to kind of jump into it. Do you really think that mold is an epidemic?
Yeah, I think it's one of the biggest public health issues we have. Yeah, truly. And I do want to say, there's like documentation in medieval times of people having, they called it St. Anthony's fire, and people would get neurological symptoms, and they would call it St. Anthony's fire because they would get burning pain, and the people would literally become mentally ill. And the reason why it occurred is they were eating rye, like rye bread, and the rye was being stored, and if it wasn't stored properly, if it had, wetness, a certain fungus would grow on it called ergot, and ergot released toxins that were neurological toxins that affected hormones and neurotransmitters. And so this is not something that's brand new. It's been around for centuries and centuries. And even in, when I studied Chinese medicine, we had textbooks that were like 2,000 years old. And there's, references to, they didn't call it mold toxicity, but these whole syndromes that are very similar. But what's really new now that's going on is it's actually, the mold is happening in our buildings. Partly, in the 1970s, they developed special types of paint that had antifungus stuff in them.
Correct.
And the fungus, nature's so smart, right? So nature fought back and developed a way to get around these fungicides and stuff. And it basically has created these funguses, molds that are extremely resistant to being killed. So just like there's antibiotic resistance, there's
Right.
molds that are resistant to different treatments and stuff like that.
The mold is really very smart, and it kicks in its survival instinct.
Exactly. That's a good way to put it, for sure. Just like anything else in nature, right?
Right.
It'll find something a way around it.
But my thing is, I'm wondering, why does everybody try to make it seem that mold is not a big issue? And the more and more that I go down to the rabbit hole about mold, literally dying for mold. And when I was growing up as a kid, I was one of the naysayers. I thought you can put bleach on mold and it kills mold. But once I got into this industry, I realized how sadly I was mistaken, that this shit is the real deal.
Oh, no, for sure.
But it's really just kind of passed over like it's no big deal.
So when I was in, conventional medicine, they do acknowledge mold, one, as an allergen, like you can be allergic to mold. So you can go to like the allergy doctor and they'll diagnose you with an allergy to mold. And then we would occasionally see in the ICU people who had like candida in their bloodstream. They would call it sepsis. And, you would literally give IV antifungal medication. And often that happened because the person had a bad infection that was antibiotic resistance and had gotten a bunch of antibiotics. And next thing you know, they get septic with candida in their bloodstream. So that's the two times that conventional medicine really acknowledges, yeast, fungus, mold. And then, of course, women with vaginal yeast infections, or kids, people can get thrush in the back of their mouth. But it's not really considered a problem. But the patients that I see that are sickest with this often have been living in a building that's water damaged. And
Right.
if the water damage is not cleaned up properly, and sometimes you can't see it, it's inside the walls. Like our house, you couldn't see anything. The place was spotless. You could eat off the floor, but we had water damage within the walls. And then when we opened up the walls, we were going to put in hurricane impact windows, and we took out the old windows and the walls. What happened with our house is when the house was built in 1925, they made concrete, and they went to the beach to get concrete, and they used the sand to make the concrete. And so the salt eroded the internal structure of the house, and then there were leaks. And it's not uncommon in a place like South Florida where you'll have hurricanes, or even if the hurricane doesn't hit, you can still have water damage. And then the other thing that can happen is there'll be no power for like 3 or 4 days or a
Exactly.
week. And when the
Exactly.
power's out, the humidity sits within the AC ducts, and next thing you know, mold starts growing in the
Having a party
yeah,
again.
yeah, exactly,
Right.
exactly. So it's a huge public health crisis. I think it's not acknowledged because the financial impacts are just devastating. We lost our house financially. The financial implications are horrible. And so I think that's a big part of why. I also think, part of my work is energetic, and mold hits you at a root chakra level. And the root chakra is like your base chakra is your survival. So like you need money to pay the rent, you need a place to live, you need food. And if that is affected, you go into like flight or fight panic mode, like survival mode.
Right.
And when your house makes you sick and you can't live at your house anymore, it's so overwhelming that a lot of people just go into denial.
And I've seen that.
Yeah, I've seen it in a lot of patients too, where they come in and they've seen 20 doctors, and I diagnose with mold. I have them do a test of their house, and their house is clearly not safe, and it's just too scary. They just can't go there.
And one of the things I've started to notice, like you say, people be in denial. That's why I want to bring awareness to just the world almost. And I think that all of us need to work together, as far as the doctors, the mold assessors, and the mold remediators. And the reason I say that is because when I go into these homes, of course, we do the remediation.
Mm-hmm.
So they think that at times I'm trying to scare them up.
Right.
But if the assessor, the doctor, and the remediator are all on board together and we're all talking, it kind of brings them at a more of, they're not on defense
Right.
as much. So if I tell them, okay, we need to gut this or gut that, they're like, no, I'm just out to just try to get the money. And I know at that point you're in shock because you never had to deal with this before.
Right.
It's kind of like when I go to a mechanic, I'm thinking they're trying to get over it. So if when you go to get your oil changed,
Sure.
first thing I think when they say, well, you need this, just change the fucking oil.
Yeah, of
Right.
course. Well, and I feel the same way because I'm trained in labs, and I can look at people's labs. I understand stuff medically. I'm not a contractor, and my husband and I were so overwhelmed when we had mold in our house because we didn't know who to trust. And then and this happens in the medical field. You'll go to a doctor with a problem. You go to 3 different doctors, you get 3 different opinions. Same thing with contractors. You have a problem with your house. You go to and you get 3 different estimates, and one's 100,000, one's 30,000, one's 3,000. You're like, am I crazy?
Right.
And so this is part of the problem is there's not a clear standard with any of this, which I think is one of the big problems. And even within the medical community, within, the holistic field of doctors who believe in mold toxicity, there's like this, honestly, there's a pissing contest. Like, oh, I won't work with somebody who is in this camp. And there's all these different camps. And, this is where politics gets to be a problem. And really what matters most should be the care of the patient.
Exactly.
But the reality is, doctors are very opinionated people.
All of them.
There's a lot of education, a lot of ego involved. And I don't think any doctor wants to hurt their patient, but the thing is, different patients will respond to different things. We're all unique individuals, and I've had some patients who need to follow one protocol, another who follows another person's protocol, and another who does a little bit of protocol A, a little bit of protocol B. And and I also I think that's one of the problems is the awareness. While this is not a new illness, it's been around, like I said, at times of mold toxicity. I really think that there needs to be at least some standardization, and yet awareness that individuals respond differently. Like environmental sensitivity. And when I first met you, you gave me your peanut story, right?
Right.
Right.
You remember.
Yeah.
Right.
Yeah. So yeah, I remember you said mold is like peanuts. Some people have a allergic reaction to peanuts, have anaphylaxis, and other people can't get enough peanut butter and they're fine.
And I want to piggyback off of that. And that's what I hate, especially for the renters, people who are renting homes.
Mm-hmm.
They're in such a bad predicament because you can have someone in your home. I talked about this before. Someone, the husband, kids, everybody's okay. And then you may have the wife who is having inflammation, coughing, brain fog. And so they think she's crazy because everybody else is okay. But what I try to explain to, of course, I'm not a doctor, you know better than I. Everybody responds differently.
Yeah.
And so that puts a mental strain on people in their own home. And so they once again, they start second guessing themselves. Am I really sick? Because no one else is sick.
It's true. No,
Right.
and you will question reality and like, oh, am I crazy and this and that? And you know, it's interesting because mold can cause a variety of symptoms. And 25% of the population cannot make antibodies to mold toxins. And so they're particularly susceptible to the toxicity aspect. So it's interesting, affect the immune system and cause immune depletion. It can cause hormonal issues. It can cause, of course, you know, part of what happens when you're living in a water damaged building, you're breathing in the spores. So you can get colonized in your sinuses. You can have like chronic sinusitis, and you go to the doctor, you take antibiotics, and you just get worse because the antibiotics make mold grow more.
I didn't know that.
Yeah. So like the classic example I give, and you know, you're a man, not a woman, but like a woman has a urinary tract infection. She takes antibiotics. What happens? She gets a yeast infection because antibiotics killed the healthy bacteria that helps keep the mold in check. And so one of the signs that somebody may have a bad issue with mold is they've had multiple rounds of antibiotics, because it makes you more susceptible to mold colonization in the sinuses and GI tract. So that's one. And then what can happen is, you know, you're breathing in the spores, and your nose is connected to the back of your throat.
Right.
So you actually will swallow the spores, and then the whole GI tract can get colonized. So people will get bloating, they'll have weight gain, they'll be craving carbs because like the mold in the intestines actually like craves the carbs. And at one point when I was really sick with mold toxicity, I would eat a bowl of fruit and feel drunk about 30 minutes later because the mold will start fermenting the fruit. Because like, you know, yeast is used to make beer and wine.
Makes sense.
Yeah.
It totally makes sense.
And then in the, you know, genital and urinary area with recurrent yeast infections, men will get jock itch, which is part of it. And then a lot of times hormones can be disrupted, and you can have all sorts of neurological symptoms. So for example, when my husband and I mold, I had a lot of respiratory and GI symptoms, and I ended up with neurological symptoms. I actually developed some autoimmune attacks on the nerves of my legs. I had trouble walking because I developed like a Guillain-Barré type of syndrome, which is when the immune system attacks the nerves in the legs, and then you have trouble with coordination and stuff like that. Whereas my husband mostly felt fatigued, and he had some hormone imbalance. You know, we took him to the doctor, and his estrogen level was like 8 times what he should be. And he was gaining weight and had man boobs, and he felt tired. And then his other issue was he was having issues with focus.
Oh, not to cut you off.
No, that's
go back
okay.
right there. So do you say mold can have issues, give you issues when you have increased estrogen in men?
Correct. Yeah, in men. And increased estrogen in women, a lot of people know that's a risk factor for breast cancer. Increased estrogen in men is a risk factor for prostate cancer. So, and also your liver has to process extra estrogen. So it's stress on the liver. So it can be and I've seen a lot of people who are exposed to mold end up with fatty liver because of the stress on the liver. But
Wow.
yeah, no, it's
right.
it's really heavy, honestly. And different people will respond differently.
Right.
And there might be, you know, in our clinic, we test for about 6 different mold toxins. So there's mold, and the mold will actually make a biological toxin that's called a mycotoxin. It's MYCO toxin, and so it's not like and toxins are literally poisons. And what's special about mold toxins is a lot of them are fat soluble, so they'll deposit in your peripheral fat, but also your brain is made of fat. So your body will sequester the toxin to try to protect you, and they'll deposit in the brain and the neurological system, the neurocognitive symptoms like I can't focus, I'm irritable all the time. I'm 42 years old and I suddenly got diagnosed with ADHD, even though I made it through school without any issues. So it can cause a lot of memory issues with focus. And I've seen, people diagnosed with ADHD, and then you start treating them for mold and the other toxins, and all of a sudden the symptoms, either resolve or they get 75% better.
But Dr. Rowe, the issue is with that, a lot of people are experiencing this, but they're not coming to anyone like you. They're going to the conventional Western doctor.
And here's the thing, insurance won't cover any of this stuff because it's not recognized.
Right.
And so, the price gets to be an issue, which is terrible, but it's true. And there's just so many factors involved. This is where too you should talk to my husband, because he has a master's in public health from Columbia and epidemiology, and he can talk to you about how public health it gets so integrated with all of this stuff. Yeah,
and it's almost like people are even worried about eggs right now, which is great, paying for eggs, and so mold is almost the last thing on their mind once it comes to getting mold treatment or going to see a functional medicine doctor.
Yeah, no, for sure.
But then I always, and I know this may seem cruel, but I always tell people, you can't afford not to take care of your health. And they'll say how expensive it is to come see a functional medicine doctor, or how expensive it is to eat properly.
Yeah.
But I'm like, medicine is way more expensive than taking care of it on the front end.
Yeah. Let me tell you, when we first opened our clinic, my husband insisted on taking insurance. And I told him he was silly, but I was like, okay, you want to take insurance? We'll take insurance. And he had a woman come in, and she had a very medically complicated situation. He spent 90 minutes with her. He billed her insurance, and he got paid $13. Now, we pay our front desk staff more than $13 an hour. I need electricity, I need rent, I need to pay for the medical record system, this and that. And so I was like, there's no way we can even it's just, so in order, if a doctor takes insurance, often what they do is they book 20 patients an hour. And then if you're, and then you can actually afford to keep the lights on, but it's impossible as a physician to do a good job if you're spending 4 to 7 minutes with a client.
And I totally agree. And it's the same way for when we go do inspection of a home.
Mm-hmm.
They'll have people come inspect and be there 30 minutes. I say, you cannot properly inspect the home for mold in 30 minutes.
Yeah, so, I'm sure.
And I tell them our price may be a little pricey, but we're there 2-3 hours. We're looking for, I'm never really even looking for mold. I'm always looking for the signs of mold.
You're looking for water damage.
Right.
You're looking for humidity.
Exactly.
Because sometimes the mold is behind the walls,
exactly.
right? You can't see it.
And like I said, especially for renters or someone who just bought a new home, if it has been previous mold issues there, it's painted over right now.
Oh, I guarantee you, yes, you're right.
And so you're getting sick, but you're telling me it's not mold because you don't see mold.
Mm-hmm.
And I say that's the problem.
Mm-hmm.
It's the mold that you don't see that's getting you sick. So it kind of piggyback off of what you were saying about when you sit down with clients, because when you sat down with me, I've been to a doctor several times, even as a kid.
Mm-hmm.
And I was expecting 15, 20 minutes, but as detailed as you were, I was amazed.
Thank
and
you.
so you think about a lot of times when people go to a conventional doctor. You're going to see the assistant. You spend more time waiting than seeing the doctor.
I know, it's true.
And
It's
then you know
true.
what they do? And the difference with you were telling me what I need to do. You sat down and asked me several questions and was figuring out what may be my symptoms, what may be wrong. Then you start telling me what I should do. Versus if I ever go to another doctor, they ask me, what you think we should do? I'm like, what the fuck? But I'm serious.
No,
And
I'm sure.
And that's kind of scary.
Well, no, but no, and I've had new clients who come in and they're like, oh, I'm just here because I want this prescription. And I'm like, that's a really bad idea. Can we have a conversation? And if they're used to the system where they just go in and say, oh, I'm here for my refill of whatever toxic med that I would never take myself.
Dr. Rowe, and I was about to say that. I look at the news, commercials every day on TV, right? Mm-hmm. And they'll say, we got XYZ pills and it helps with XYZ. Tell your doctor the next time you go. And I'm like, something's wrong with that picture. How am I going to tell my doctor to give me a pill? That's backwards.
Yeah, no.
So it's like it's all about the money. Like it's a system that's all about the money.
No, and honestly, I have deep compassion for the doctors who are working in the system because the system's really broken. And burnout's really high. And I think especially post-COVID, a lot of nurses left, a lot of doctors retired. And I think it's a huge problem.
I do too.
And I don't even know that it's fixable at this point. I think the system that's there kind of almost has to fall apart, and we need something totally new that's centered on health, not centered on illness.
You know what? My daughter, she goes to Boston University,
Mm-hmm.
and she told me something very simple. She's a biology major, and so I had a headache, and I was on the phone with her,
Mm-hmm.
and I said, "I got a headache. I'm gonna go buy me a Tylenol." And she said, "No, Dad, you need to figure out why are you getting a headache." And I said, well, "I'm just gonna take Tylenol and I'll be all right." She said, "No, the Tylenol is just masking the symptoms." She said, "It's a reason why you're having a headache."
You have a very smart daughter.
And so when I heard that, I never thought about that before.
No, but yeah.
Because I'm a part of the system.
Sure, we all are.
Right.
We all are. I mean, I drank the Kool-Aid. I passed my medical boards. I passed all the steps of the United States medical licensing exam. And yeah, no, it takes a lot to stop and step back and really have a bigger perspective like that.
Right.
They actually did a study that 90% of headaches can be relieved by releasing the tension in the neck and shoulders. Now, 10% no, but that's pretty amazing, right?
It really is. It really is. But Dr. Rowe, I want to get on pregnant women. We were talking about this earlier, and it came across my mind last night. So can women who are pregnant that wind up with mold toxicity, can they pass it on down to their unborn child? Yeah,
so it's interesting. Several things can be passed from the mother to the fetus. And when we were in med school, you have so much information you have to memorize that you learn these little mnemonics, which is like things to help you remember. So like they call it torch syndrome. So toxoplasmosis, O is for other, R is for rubella, C, oh no, now I forget. Anyway, but each one stands for a different infection that can affect the baby and actually affect like the baby's development and stuff like that. And sometimes if you're exposed to these things while you're pregnant, it can affect fetal development. And then there's a bunch of toxins, like we know that lead and mercury can be transmitted through the placenta. And so if the mother is toxic in mercury, it will go straight through the placenta. And so when you're pregnant and you go to the doctor and they say, don't eat swordfish because swordfish is off the chart in heavy metals. And we know that, and that's why. And they'll even limit like how much fish you eat, or they recommend, don't eat more than twice a week while you're pregnant because of these type of things. But they do know that mold toxicity, the toxins that the mold makes, not the actual mold, but the toxins can pass through the placenta and affect fetal development. And so it's really important when women are pregnant to be on binders. Binders are like one of the crux, the base treatments of mold toxicity. And basically what you do is you take things like charcoal, zeolite clay, chlorella, all these things bind to the toxins so that you poop them out and they don't keep circulating in the body. And it's one of the most important things if somebody's pregnant and has mold exposure is that they go on binders because it helps pull the toxins out of the cycle. And then, whenever somebody's pregnant, you don't do any aggressive detoxification. So if like, for example, I'll give you the Mercury or example. So if somebody's pregnant and they have high levels of Mercury, you don't want to start doing like chelation therapy or aggressive mobilization of the Mercury that's already there, because then if it's mobilized, it's going to be in the bloodstream. And then again, the fetus is going to get a higher exposure. So you don't do any super aggressive detox. The detox should be before pregnancy, after pregnancy, but during pregnancy, you just kind of put people on binders. That's the recommendation. Yeah.
And I don't believe many women even think about that.
No, no, and it's not even thought of as. I think it's totally out of the awareness of most people. Yeah, but thank God for the internet and podcasts, and people are really. A lot of people are realizing that you have to be proactive with your own health.
Exactly.
Especially younger generations,
Exactly.
So.
And that's one thing I'm going to ask you on also. I'm thinking now that I want to bring awareness to people to say, I believe once yearly, I don't think it would hurt at all to come see someone like you to just get a yearly checkup for mold toxicity. Because like you said, being proactive is a whole lot better than once you're so far down the rabbit hole with brain fog or your immune system got weakened from mold. Now it's to battle back from it. Once you catch it early.
I wish I had done something like that, but I didn't know.
Right.
It wasn't until I really got sick. And the thing is, I still have high levels of mold toxicity when I check a test, but I'm asymptomatic because I'm in treatment. So, I'm doing my binders, I do my antifungal regimens and stuff like that. And I'm able to function and be relatively, symptom-free. I still have like 10% of symptoms, but nothing like what it was before.
You're a whole lot better.
Yeah, for sure. But yeah, I do think it's important to look at, sick burden ever. And I think it's because there's, pesticide exposure. Right now, chemicals are not considered unsafe until they're proven as unsafe. You would think, oh, they have to prove it's safe. No, it's when once they're proven as unsafe, right, then they're like, oh, we need to take this off the market. So, I think all of this stuff is shifting. And the beauty of doing a lot of these treatments is you're not just treating mold toxicity, you're treating the heavy metals, you're treating the pesticides, you're treating, organophosphates and phthalates and bisphenols, which is, all the garbage and plastic. And, because really a lot of what you're doing in treatment of mold toxicity is you're supporting the body's ability to detox. And the main way you detox is sweating, of course, urination and bowel movements. And then, if it's severe, your body will detox by vomiting. If you if you have food poisoning, your body's like, get that toxin out.
You know what? And it makes sense that you just said that, because I'm thinking about my younger days when I just was drunk, and then you get so drunk that you vomit.
Yeah, that's your body saying, "Oh, I'm going to get rid of that."
And and it makes sense. I used to just think, "Oh, well, I'm just sick."
Yeah, no. It's
a
literally a
detox.
Yeah, it's a detox mechanism.
Right.
And I think that's where some people like who do plant medicine and the shamanic ceremonies where you vomit, ayahuasca and that kind of stuff. Part of it is, there's, psychological effects, but part of it is just detox, like physiological detox, because you're vomiting out old bile and your gallbladder's involved in all this stuff. And it's very interesting when you really think about the bigger picture of it.
Let me ask you this question. I know it's kind of in left field, but since we're on the
No, that's nothing is too weird for me.
I'm wondering our body, and I know I may be speaking out. I don't know. I'm just gonna say it. Body is a machine, and it really can fix itself. And when you get immunization shots as a kid, and they got so many immunization shots that you get now, it stops the body from building up an immunity to fix itself. And I believe now we're just so fucking overly medicated from what we can take care of. Our body should take care of itself. But then at the same time, we're putting a lot of toxins in our body from the food.
I think you're right. Like if you cut yourself, let's say you get a paper cut, 2 weeks later, you can't even see where the cut is because your body's that magical, it heals itself. And I mean, even like with surgery, sometimes the surgeon goes in, they cut something out and they heal it up, but the surgeon doesn't heal you. Your body like slowly heals that up. And it's pretty magical when you think about it. I mean, like what a blessing, right? Like, and I think that a lot of my medical training, that wonder of it all was lost. It's like, oh, this is happening, so we have to do this. But I think often if you give people the space to heal, and by that it's, like clean food, clean water, cut out the Doritos and the Coca-Cola.
Clean air.
Clean air.
One that's always
clean
left
air.
Out. Right.
And then even just like proper rest, like, not having sleep deprivation, and like just imagine you're really sick. What do? You want to go lie in your room and have it be quiet. And there's something about quiet, that is lost in our society. There's constant stimulation. Like even the nicest store or restaurant you go in and there's music and but I think we are overstimulated at so many levels, and it does prevent us from truly healing.
And we're addicted to it. It's almost like
I admit I am too.
And the first thing my daughter was telling me this, she was in high school, and her phone had tore up, and I had to order her a new one. And she was like, "Dad, it was so crazy. I was walking down the hall. She caught herself turn the hand,
like to check her phone, and she didn't even have her phone.
She said the system has got her screwed up. So it was just automatic.
Your daughter's
her phone
very
is not even
smart and aware.
It's not in her hand. She was just
the
habit of. But it's the first thing we do. We don't even have alarm clocks anymore. First thing we do, grab our phone. It's just noise. It's all. And then people always got access to you.
Yeah. No, and that is a problem because it's important to have decompression time.
Right.
Yeah. No, and even you shouldn't have to respond to a text at 11 o'clock at night. It's I mean, granted, if I'm on my emergency room shift, yes, then it's appropriate. But but I do think it's an issue, and having space to heal for that magic to happen, for you to be able to heal the cut or the wound or the inner lining of your sinuses. You need I don't know, but hopefully things are shifting. I think there is more awareness.
It really is, now, especially with the internet and people who really realize that the system, especially the medical system, that I'm not saying everyone is, but it's more about the money. It's about the money instead of health, because I don't believe it's no money in healthy people.
Yeah.
And I've seen someone else say this. I can't take credit for it. I wish I could. Say you never heard a doctor ever tell a person, give them a prescription to say you need to eat less and get outside and walk. Never heard it. I forgot who said that.
Yeah.
But they always prescribe you a medicine. But sometimes like you said, you just need to decompress, eat better, better quality of air, and exercise.
Yes,
but
definitely.
instead you're gonna put me on medication, and then it's toxic medication.
Right. Now, I do have clients where they come in and, I see labs and we're seeing a problem, whether it's cardiovascular inflammation or whatever. And I give them lifestyle counseling. They come back 6 months later. What have you changed in your life? Nothing. So, and I've struggled with lifestyle changes myself. I've done a lot of them.
True.
I had to do a lot of dietary and lifestyle changes myself in order to get better. So it is heavy because, you have demands from other family members and what if you're the caretaker for a child who's sick or an elderly person who has dementia? I mean, it's very complicated and then you have to go to work and then this and that. And, next thing you know, you're not taking care of yourself and it happens.
But do you think we put a lot of that pressure on ourselves unknowingly, just getting caught up in the system?
Yeah, I do.
Right. And because when I grew up, when I used to come home from school, I did my homework. I got outside on a bicycle, rode a bicycle, played basketball, stayed gone all day. And so now I'm looking at kids nowadays. It's everything. They're not getting outside.
No, it's true.
You can go through a neighborhood right now and see anybody on a bike.
No. Yeah.
And so now you're looking at kids who are just morbidly obese at a young age.
Then imagine that if you have mold toxin in your house and then you're not leaving your house.
I never thought about it like that. Even this, when we were kids, we used to open up windows. How many kids you see now open up windows in the house? And
I can't even open the windows in our office.
Right.
Yeah, because we're on the 6th floor and everything's sealed.
So we're trapped in.
And indoor air quality is a huge issue.
It's worse than the outdoor.
Yeah, often.
Right.
Yeah, often, for sure.
And so I even try to tell people this, like we were just talking about, everyone can't afford to get remediation or everyone can't afford to come see a doctor.
No, it's true.
And so people get upset at me if I give the advice of things that they can do. But what I tell them to open up your windows.
That's good advice.
Or you can build your own small air filtration device. I tell them just get you a box fan and get you some HEPA filters and tape it up. Of course,
that makes sense.
Yeah, but I'm telling them it's not going to cure it, but it's better than doing nothing.
Yeah, sure.
So I always try to just give them options to do whatever that you can do. And so even with, like you were saying, with opening the windows and everything being energy efficient, how we're trying to build things now, with everything closed up, spray in insulation, the mold cannot get out.
Yeah, that's true.
It's stuck in. And so, and people are more concerned about.
And it was bad during COVID because a lot of people didn't have options to leave their house. And this is where I saw a lot of mold toxicity afterwards. And, I had people who had toxic mold in their house. And I was like, look, do you have a balcony? And sometimes they do, sometimes they don't. I was like, look, even if you go out on the balcony 2 hours a day.
I never thought about that.
Yeah, but we saw way worse mold toxicity during the COVID because a lot of people were just staying at home. And if your house had water damage and it wasn't appropriately fixed, and sometimes you couldn't even get a repairman into the house because of COVID. I mean, it really affected people.
But I wish people just would, even if they have water damage, would take it more seriously. Because by them not taking it seriously, because I've seen this with some of my clients, and maybe you have too, they can't understand. Once I do a deep dive and ask them, have you ever had a leak? And they're like, no. And then so we're looking. Then all of a sudden I may see some bubbling in the wall. They'll say, 2 years ago, we...
No, it's true.
Right.
No, and we have a screening question on our have you ever lived in a water damaged home? Have you ever had a leak? This and that. No. And then you start talking to people. Oh, 2 years ago.
Right there.
The bathroom ceiling fell in and my upstairs neighbor had a leak.
Right.
And then they had to fight with the condo association to fix it. The neighbor didn't want to fix it. And then sometimes they just don't fix the leak properly. And leaks are a bitch. They're hard to track and find.
They are.
They really are. And and I don't even necessarily think it's incompetence. It's just really difficult. I mean, as part of the nature of water, it'll run anywhere. And then when you have that wet sitting inside the walls, it's just, especially in a hot, humid climate like Florida.
Yes.
No, and Miami's a particular problem because you know, if you look at the history of like Miami Beach, we're the original real estate scam. You know, like all these guys built these real estate developments in Miami for quick money, and it wasn't for sustainability. It was to make a big profit. And part of what triggered the whole big crash with the Depression at the end of the 20s, early 30s, was the whole Miami real estate inflation. It's fascinating. There's a great book called Bubble in the Sun that's all about it. But it's the history of Miami, and it's still continuing. And yeah, you see a lot of poor quality construction done quickly for big bucks. And you know, I've seen very expensive, very expensive homes and apartments and condos, like penthouses, that were poorly constructed.
Let me tell you what we're seeing a lot of now. We're seeing a lot of mold issues in new construction, like you're saying.
Mm-hmm.
And so people are thinking once they buy them a new home, they're okay. But a lot of contractors are putting molded wood and building these homes with already. And so I'm getting off track. This is what I have an issue with.
Mm-hmm.
When an inspector comes in, an inspector is not looking per se for mold.
Mm-hmm.
So now you got an inspector, he's clearing that house for them to close it up.
Right.
But now you got 2x4s that got mold on them. And once you close it up,
You
and
don't
once
see
again,
it.
you got a $1 million, $2 million home. And the family's like, no, this home is brand new. I don't know why we're getting sick. And I ask them about mold. They're like, no. They keep on doing a deeper dive. Some of the studs they put in were affected with mold.
Wow.
So it's like people are not, everything is how quick I can get it done.
Yeah. No.
Yeah.
And we're going back to the problems with the whole society, right? You know, in Chinese medicine, we have the concept of yin and yang, and yin is nighttime, it's cold, it's dark, it's stillness, and yang is like the sun and brightness and movement and sunshine. And, you need a balance in Chinese medicine between yin and yang. Right. And we live in the most yang society ever. It's go, 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 go.
Right.
Because like a marathon's not enough. You got to do an ultra marathon,
right.
And what happens when you have too much yang, eventually you burn out. And so like an everyday example is, and this was one from my 20s, you're doing shots of tequila, you're dancing on the bar, you're having the most fun of your life. It's peak yang,
right.
And what happens the next morning? Crash, right? So that's yin. You pull the blinds down, cover your eyes, you don't want to move, don't make any sounds.
Right.
And that's when ultimate yang turns into yin. And so that's where you get the burnout, right? And we are seeing a lot of burnout in our society on so many levels.
Why do you think we're like that now? Just go, 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 go.
I don't know, but I'm almost 50 years old now, and I'm really trying to cultivate slowness in my life.
Stillness.
Yeah,
right.
Yeah. I started just for fun. I draw, and I'll really take my time with drawings, and it's like a type of meditation for me, and it really helps me generate that stillness. But I, and I can get caught up in the go, go, go as well, and even. If I have a very medically complicated case or see a lot of pain and suffering, it'll keep me up at night. It'll affect me, and so I need something to help balance that so that I can stay level-headed and be clear mentally and do a good job and not just be responding out of stress,
You know what? I believe, and this is just my personal belief, I believe sometimes we be on go, 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 because I believe we're running from something. We don't want to deal with something that's inside. And the reason I say that because I've dealt with that personally.
Mm-hmm.
And when I realized that, when I sat down once and I tried to meditate,
Mm-hmm.
someone tried to introduce me to meditate. And one of the most dangerous places to be, Dr. Rowe, I promise you, is in your own head. And so when I really sat down and started getting still and got into meditating, and I start realizing my shortcomings everywhere where I was fucking up at personally, traumas that I hadn't dealt with, it scared the shit out of me.
Yeah, no.
And so therefore, I said, let me get another drink.
Well, I think that's what happened during COVID. a lot of people were home with their own thoughts. And that's why, anxiety and depression and, when all of a sudden the lockdown lifted and, people were coming back out, I had a couple clients who had been, drinking heavily and stuff like that. And I had to refer them to rehab. It was just because it was that bad. Yeah, no, but
trying to deal with your own inner being,
for sure.
Scary, but you need to. I believe this, like I said, I believe that's why we just try to self-medicate by being just busy. And because when we're not busy and we sit down and, like you said, during COVID, and you have to sit down and you really got time to decompress, then you realize your issues.
Yeah,
but that's just my personal opinion.
No, I mean, I've definitely struggled with that kind of stuff myself. For sure, and and it takes a certain strength to stop and self-reflect. Yeah, right.
It really does.
Really, yeah.
But let me ask you this question.
Sure.
It's great talking to you. But what are some of the signs that get misdiagnosed? Like, what are some signs of mold that get misdiagnosed with something else?
So I've had patients come in with benign fasciculation syndrome, and so what their muscles are basically twitching by themselves, and like when you go like this, your biceps like contracting, but it'll just start like moving by itself. It almost looks like a bag of worms, within your muscles. And then you go to like the doctor, they send you to a neurologist, and they say, and often I've never seen a case of like muscle spontaneous switching that wasn't elevated toxins, either from heavy metals or mold. I do see a lot of ADHD and poor focus that's actually due to elevated toxic burden. And, once you start taking the toxins out, they no longer meet the diagnostic criteria for ADHD. So what does that tell you about the whole system of psychiatric stuff? I've had a lot of clients diagnosed with depression, but then when I talk to them, I was like, do you have a list of things you want to do? And they're like, yes, I want to do all these things, but I'm too sick to. And, that's not depression, because depression, you don't want to do anything. Whereas this, they have a list of things they want to do. They just feel so bad they can't do them. But often, they're offered antidepressant medications, anti-anxiety medication, antipsychotic medications.
Really?
Yes. I've seen several of my clients have been recommended, oh, here, take this Seroquel for sleep, which is, an antipsychotic, which is scary. Yeah, it's very scary. A lot of gastrointestinal symptoms, abdominal bloating can be mold toxicity, migraines, PMS for sure. And it's important to actually do a test so that you can see what you're dealing with. And sometimes, I suspect mold toxicity, and the person is so sick that they're not able to detox at all, and the mold toxins don't come out. And so what'll happen is you treat them for a few months, and then you recheck, and then the toxins start appearing and coming out. Gotcha. So my sickest patients, they can't sweat, because that's one of the most important ways you detox. And often they have chronic constipation. They're not having regular bowel movements. And that's one of the other ways that's really important for detox of mold. So if I have a patient who comes in and, they'll go to exercise class, they keep up with everybody else is sweating and they're not sweating, that's a sign of mold toxicity, because part of what mold does is it breaks down detoxification.
Right. So what would be 3 others that would you recommend to tell people that if they experience these symptoms, that they should come see someone like you because they might have mold toxicity, besides not sweating and no bowel movement? What would be 3 others?
I'm chronic sinusitis, unexplained gastrointestinal problems. Now, if you have 3 margaritas, French fries, and a pizza, the pepperoni, and you have like acid
right.
reflux, you know why you
that
feel
is.
that way, right? But if you're eating like super clean and healthy, and you're still having a lot of bloating, abdominal pain, alternating diarrhea, constipation, whatever, often you're colonizing the gut with mold. And then, unexplained brain fog, issues with focus, that is often mold toxicity.
Do you think ADHD gets misdiagnosed?
So I don't think it gets misdiagnosed. I think often the people meet the diagnostic criteria. So the way a doctor diagnoses ADHD is there's a list of symptoms, like can't focus and this and that. And you have to have, for example, if there's like 10 criteria, you have to have 7 of them. And so the doctor will go down the list, and yes, you have 7 out of the 10, so you meet the diagnostic criteria. But what psychiatry doesn't look at is what's causing those symptoms. Psychiatry is based on a list of symptoms, like, oh, you're having these symptoms. It's not looking at root cause.
Right.
So that's really where I have issues with it. And just like mercury toxicity can cause bipolar type symptoms. And then you take the mercury out, and people get better with mood stability. So they have a saying, like from, like Alice in Wonderland, the kids' book. They have a saying from that called "Mad as a Hatter." Well, they used to take fur and they would process it to make hats. And the way they processed it was with mercury. So all the people who made hats would become mentally ill from working with mercury for years. And so that's why they have that saying, "Mad as a Hatter." And mercury toxicity can cause all sorts of mood instability. And people will meet the diagnostic criteria for bipolar disorder, and then you treat the mercury, and everything kind of smooths out. And it's not that it's misdiagnosed; it's diagnosed according to the system. But my question is that who you truly are, And often there's genetics where detoxification is impaired, and it's very interesting. I mean, you can really go down the rabbit hole. Speaking of Alice in Wonderland.
I'm going to tell you, I wanted to share this with you before we close up. This is one thing that we're starting to do over here at our company. I was trying to figure out a way to be more proactive with clients. So we're starting a program with them. Each year, we're coming back to give them an inspection just to try to stay ahead of them getting mold exposure.
Oh, that's lovely.
Right, because I started realizing by the time they find out they have mold, it's too late.
Yeah, no,
It can be caught so quick.
Yeah, it's much harder to treat if you let it go. Right? Whether it's blood pressure, diabetes, anything, being overweight. Like if you have to lose 5 pounds, okay, not a big. If you have to lose 100 pounds, then it's just overwhelming.
Right.
So anything, it's much easier to deal with if it's before it becomes a major issue. So I think that's extremely smart that you're doing that.
Right. Because it hadn't affected me or hadn't affected anyone close to me, mold toxicity, but just from seeing the clients and seeing even some of your clients it's heartbreaking.
It is.
And I don't think people take it serious, because even though we've done mold work, once I started seeing the people who are really sick from it, I looked at it from a totally different lens.
Yeah.
And you're like, this shit is real.
Oh, it's very real.
And it started making me, and I know I'm wrong for this, I used to go in and not put on my mask.
Mm-hmm.
But once I started seeing people who are really sick, I start taking it very, very
No,
serious.
I
said, because that can be me.
No, and the first time when we had mold, we hired a contractor. He opened the walls and he was exposed to it, and we were all exposed to even more toxin because of it. And now that I know what I know, I would have during the remediation, I would have moved out. I would have gone to a hotel, gotten the dogs out, and if I had to go back in, I would have gotten a hazmat suit on,
It's really that serious.
Yeah, really.
Honestly.
Yeah, for sure.
But Dr. Rowe, if you can just tell us, man, how to find you guys.
So our website is miamibeachcwc.com. We're called the Miami Beach Comprehensive Wellness Center. We do currently have a waiting list for new clients. Unfortunately, there's no shortage of pain in the world. But yeah, you can call the office and get on the wait list. And then,
What's the phone number?
305
Okay.
397 8229.
Great. Well, anything you have for me, we're wrapping it up then.
No, I think that's
was
it.
great.
No, thank you so
It was
much.
great having you.
I feel honored that you asked me to be on your
No, it's
podcast.
a blessing that you came. It's a blessing that you came. And one patient at a time, we're going to change the world.
I hope so.
Yes.
Fingers crossed.
Right.